Aloha, I'm Sherry Boschert reporting for Global Medical News Network at the annual meeting of the American Psychiatric Association. Psychiatrists are trained to treat stalkers, but sometimes they become the ones being stalked. Dr. Gail Robinson has more.
In our report, we found that psychiatrists had the highest rate of being stalked. That's probably related to the nature of the kind of relationships we have with our patients, whereby they can either think they fall in love with us or they can be very angry with us because we're not giving them what they want. The next group in our study was obstetrics and gynecology. Again, some of those may be of the same nature of feeling that they've had a particularly intimate relationship with this doctor and then nothing's happened to it. Or it can be anger if there's something that went wrong with their care. And the last group were internists who could also get into difficulties. But any specialty can get into difficulty. So you don't want to sort of say that just because you're in general practice that you're safe. All could be in danger. There's always a difficult question, especially for a psychiatrist, as to when behavior crosses over from just being a transference reaction or normal expression of feeling in a patient which you feel you should tolerate and understand and help them work through, versus when it becomes actually dangerous. I think that it becomes dangerous whenever it starts to become intrusive. So it's one thing to come to a session to talk about feelings, to have a back and forth trying to understand what's going on. It's a totally other thing to start calling the doctor all the time, to be hanging around outside the office, to be emailing them all the time, following them home at night. So whenever it starts to get to a point where you start to feel this is not just what we're discussing in the office, this is intruding into my personal life, you should certainly be very worried about that and take steps to intervene. In our sample, we found over 14% of people reported stalking. Other studies have found between about 6 and 13% of healthcare professionals were stalked. So that's a relatively high percentage of people, if you think about it, who are getting harassed by patients in some sort of way. It's important to be aware of stalking, to understand what it is, so that you can spot it when it happens. You don't just keep trying to understand the patient. There's a point where you say, this is crossing the line and I have to decide what I'm going to do to stop it. Sometimes just talking to the person, dealing with it, not necessarily in a confronting fashion, but saying this is inappropriate and it really can't go on, may be enough to stop it. But sometimes you have to go further and decide to involve police, to terminate your relationship with the patient. But you can't do any of those things if you don't recognize that stalking exists and it might happen to you.
Reporting for Global Medical News Network, I'm Sherry Boschert.